So let us move on to the Q&A. If you have any other questions, the audience can unmute and they can ask.
Good evening. I am Colonel Nandi from Kolkata. Yeah,
Hi,
am I audible?
Yeah, please audible, sir.
Yeah, first a compliment to both the speakers. The excellent talk, quite enlightening. I have a small query to Dr. Duraisamy regarding this Icarin. Any preparation which is available in India or something?
Which one, sir? Sorry.
Icarin, the horny goat weight you mentioned. Any preparations available?
Sir, available, sir.
What trade name? Any idea? Have you ever used?
Sir, I didn't use, but I can find and let you, sir.
Sure.
I know one of the one of the products. It is called testosterone. Testosterone, available by Ace Life Sciences India. It's not expensive, but it's a very effective drug. It's got the same effect as what PDE5 inhibitors do. The trade name is testosterone. Testosterone. Testostone.
Sir. And
from Ace Life Sciences India.
Right, sir. Ace Life Sciences. And regarding the vacuum erection device, sir, which one do you advocate? There is any particular experience with any particular brand or something?
Sir, I tried with more than 50 patients.
In which one?
For elder.
Which type of VED? I just wanted to know. Which particular?
Particularly to whom they not respond for PDE5 inhibitors.
The theory I know. I am asking any VED, which particular type VED company, which one, any VED by which trade name, which?
So previously I got from Kerala, one of the company. Nowadays, last more than 8 months, they stopped to supply me.
Okay. What was the name of that?
Sir, I don't remember. You just text me. Tomorrow I will send the address.
I can show you some of the available thing in Mumbai by a company called Gizmowalas. I can send you the number.
Sure, sir.
There are two types of pumps which I prescribe to my people who do not want medications or who had side effects of medications. Number one.
Sure, sir.
Number two, who do not want surgeries.
Yeah.
So these patients are very okay with it, but it's very cumbersome,
Yeah, I understand. Sir,
I have two different types. I can send you the details, Dr. Nandi.
Sure.
And I can also tell you there is one company called Gizmowala, who have been officially appointed by the government of India to sell these things. And they are not expensive. These two cost me only 3,000 rupees, both of them, Total cost was 3,200 or something for both of them. One is an automatic thing, and one is to inflate and create a vacuum and all that. But the only issue with this is the band which is then, connected to the shaft of the penis at the base. That pains many patients.
Yeah.
That's the only complications which I have faced. Otherwise, okay, they are okay with it. And the only thing is cumbersome to carry everywhere whenever they're traveling and all that. So at times, even the customs people asking, what is this? Why are you taking and all that? So, there's an embarrassment, and this is the only thing which I have faced, but it is available. It is not non-invasive. So that's the best thing. No complications internally to your body like headache.
And sir, with a prescription, they can carry, in a flight and all.
Yeah, they can carry
the prescription of a doctor.
It's not a contraband thing, but
absolutely
they ask because of the shape and other thing. They ask, what is this?
And sir, regarding this testosterone, what is the approximate price? Like it is the testosterone capsule.
It is about 120 or 120 rupees for 20 tablets or 10 tablets.
And that same one capsule SOS, or it has to be given regularly?
Yes. Once a day you can take it.
One is like that.
Have to give regularly.
I remember the cost is going around 799 per strip. Per strip of 10, if I'm not wrong.
Testosterone.
It is called as testosterone.
Testosterone. And the dosage is one capsule per day in the
they will tell you can get 2 capsules per day.
But 1 or 2 per day you can take it. 1 or 2 per day is fine.
And for about 4 to 6
ideal
weeks.
effects is the 2 per day, but if they're taking it for a long term, 1 also is okay, but they can take 2 per day, no issues.
And the constituent is that Icarin, sir. It has got Icarin.
Yeah. It has got Icarin, horny goat weed, and 2-3 other things also. It
Yes,
has
sir.
got.
It's more like a
Yeah,
nutraceutical.
it's a nutraceutical. It's a nutraceutical.
Thanks a lot, sir, for
I just want to add few things. We even have this motorized thing just for the audience sake.
Yeah.
Because when you give for the elderly, they find very trouble in pressing the pump.
yeah.
So we do have this motorized thing which comes with the battery,
Mhm.
and we have this like electronic thing.
Is
So
it the
this
same
here.
the same company which Humani sir
It is the
mentioned?
same. See, auto
Almost
powered.
the same. Almost same.
Yeah.
So automatically, you don't have to do anything.
Yeah.
Just
And price
set
is
it.
around 1,500.
Yeah, around total these two cost me
3,000 you said.
3,200. So I
Sir,
keep
sir.
these two to show it to my patients, and I give them the number of Gizmowalas. They go and buy it from them.
Great, sir.
Many things available online, sir. You can just visit some.
I know. That is, I know, but I just wanted an experience, any particular.
No, see,
brand, that's
there
all.
is a particular brand called as vacuum. It's called as it is FDA approved,
Which
but
one?
it is quite costlier. I think it is around $499.
Yeah,
Ericade.
Yes, something like that. Yes,
Ericade is that thing.
that's very
that is
costly.
quite costlier. Yeah, that is
Yeah,
quite
yeah.
costlier.
For our patient, it's difficult.
There's
Indian patient.
one of our doctor friends from Pune. He also has this, but he sells it for only 1,000 rupees or 1,200 rupees. Think Dr. Maheshwari or somebody, because he told me, you want any number, I can send it to you.
Oh,
He
excellent.
sells it for about 1,000 or 1,100 rupees each. It's a plastic thing, completely plastic.
It has been modified by him. It has
Yeah.
modified. Oh, excellent.
Not modified. He might be getting it from somewhere. He doesn't manufacture, but he
Sir, sir.
sells it.
Thanks a lot, sir.
One question,
sir.
Dr.
Sanjay,
Deepak.
sir.
Dr.
Welcome to the
Vijay
program.
speaking.
Yes.
Yeah.
Dr. Vijay.
Hi,
Okay,
Vijay,
Dr.
sir.
Vijay, welcome.
Yeah, how are you, Deepak? After a long
Very
time.
good, very good, very good. Tell me.
Yeah. The board discussions were very nice, very fine. In proper practice, out of all diabetic patients, those who are under treatment of medical line, how much is the percentage of rate of conversion to implant and acceptance? Out of how much is the percentage?
You mean to say for implants?
Means how many patients after treatment are comfortable with medical nerve treatment and how much want to go for implant? Because to go for an implant and to fitting it permanently, many people take it as a last option. So there is again big zone of dilemma to whom to do implant, with surgeons also.
See, if all depends upon how you manage the case.
Yeah.
Every diabetic, every hypertensive, every obese, every dyslipidemic should be first counseled to bring back their metabolic thing at normal level. They have to reverse the metabolic syndrome. That's the first thing they should learn to do.
Yes, correct.
They
That
do
is most important.
The milieu becomes euglycemic, non-hypertensive,
Yeah.
or normotensive, lipids come back to normal, and they do lifestyle modifications. Then diabetic patients whom we give metformin, which has got an endothelial protection effect. Number two, SGLT2 inhibitors, which are fantastic. They got weight loss, they control HbA1c, antioxidant effect, and all that. And also, we give them acarbose. So if these three things are given, their endothelium almost is preserved. And another drug which is now come in the OHS is imeglimin, which also improves the mitochondrial functions. So these four drugs, if you give them, they do start getting morning erections. My friend Dr. Jyoti, they put patients on insulin pump. So there was constant monitoring, constant delivery of insulin. So their sugars never went up, and he studied, and his trial showed that 84% of the patient improved in their sexual functions. So that is the first thing. And then along with this, if they have a still problem, you can give a low dose of tadalafil, 5 or 10 mg, along with measure his testosterone, because every diabetic is hypogonad. So also give them testosterone in a short course, give them for 6 weeks. Equaveron is now available as 25 milligram intramuscular once a week for 6 weeks you can give, or Sustanon 250 milligram once in 3 weeks you can give. And then they definitely get better, because in diabetics, what we have studied is not only they have reduced blood flow in the penis, but they also the integrity of the penile corpora cavernosa gets affected, which is managed by testosterone. So testosterone is very important for them, along with PD5 inhibitors, along with lifestyle modification and control of all the metabolic. If you do this, they have definitely, and this is the onus of all these lies with we physicians, patients will not do on their own. We have to constantly call them, counsel them on all these things. And then very few of my patients have gone in for penile implant because penile implants is an expensive thing. One of my patients said, doctor, my penile length has reduced after the implant. Number two, one of the patients had complications. They had to remove the whole implant. One patient got infected. So, so there are a lot of complications and ultimately if one penile implant is removed or has complications, the mental torture is too much to the patient and it also affects us. So I try to counsel them very well, bring back their metabolic syndrome to normal, and then give them all these things which I just mentioned, and they do better.
Yes, means selection criteria is most important, and penile only erection is not the goal of all his sexual activity.
Yeah.
This means, yeah, and that is the reason after finishing all things, any patient demands at the end, one must go because after removal of implant, it is a very, very difficult to manage the case. Very difficult. Yes, correctly, I told you, man. It's a very excellent explanation that everywhere penile implant should be the last resort, the last.
And what is the
Thank you.
cutoff limit of HB1AC you usually recommend? HB1AC, how much? Next.
It has to be always brought down to 7.
Okay, below 7. And but
Yes,
as
then
you have rightly said, sir, it is the last resort because it is after that the end of the road. We can't fall back for anything else. So,
Only erection is not the purpose of activity.
Absolutely.
That is most important to be remembered. It's the last resort and everything has failed and there is no option, and that is the indication for implant.
Thank you, sir.
Thank you. Very nice to see you after Ahmedabad conference.
Yes,
correct?
sir. Nice to see you, sir.
Yeah. Hello. Yeah. Thank you.
Thank you, sir.
I have one personal question to Dr. Shivadev. Dr. Shivadev, because we used to give these SSRIs to patients with premature ejaculation, and we all know it can cause some spermiogram abnormalities. So how do you see that? So should we give? How long to give? What should we tell the patients?
So it's used for a very period only, and then only when
you are not audible. Hello.
Can you hear now?
Can a bit come closer?
So can you hear me now?
Better.
No better.
Okay. So it's mentioned like only very brief period is what I'm mentioning, because as I mentioned, it was very specifically ovulation rate anxiety, and then you will try all the therapies, behavioral modifications, and still if the systems are getting activated. So if you give it only for about maybe 4 weeks or 3 to 4 weeks or 6 weeks maximum is all I'm looking at. We're not looking at extended period. So it won't be having a lot of side effects, and also that it will be in very low doses that we look at it.
So we start with a 12.5, then we go to 25.
Paroxetine 12.5 is usually more than enough. And if it's sertraline, maybe if you look at anxiety, right? So the generalized anxiety, if at all they have a lot of anxiety before, so that can be where 25 mg can be given. But if it's a very specific thing, 12.5 milligrams of paroxetine or 50 mg of sertraline. Sertraline works wonders for the thought processes, which is a lot of obsessive compulsive disorders, and that's usually very well tolerated. So low dose of 50 milligrams is also good enough for maybe 2-3 weeks, coupled with behavioral modifications and extensive counseling. So like I told, the breaking of the cycle between a couple, because the female anxiety will be on the male anxiety on the female. So all these cycles, if you break, I'm telling you, guaranteed, even SSRI is also not.
How?
Sometimes we have.
Can you stop it immediately after 10 days?
Yeah, because there's no dependency. There's no amount of the extended
rebound effect
use
won't
itself.
Rebound
withdrawal symptoms will not be much, because it's a low dose, number one, low duration that is given. So usually we don't experience a lot of withdrawal symptoms if it's like 3 to 6 weeks.
Nowadays people see this Google and they come and ask us, sir, SSRI induced sexual dysfunction. And we
Very
explain
true.
that as a psychiatrist. So
Yeah.
see,
So
like,
what we tell them is like, you know, there is a, because I also have worked in pharmacovigilance, like as you know, Dr. Nateshprabhu, you know, we are also profiling these drugs, right? So what I tell them as a psychiatrist is, number one, if you've been on many number of years at a dose that is required for antidepressant effects, that is to be optimized doses only. Like suppose sertraline is given in 200 mg for 2 years, it's a different story. So if I'm giving sertraline 50 mg for about 3 to 6 weeks, it is a win-win situation. When anxiety is high, it works positive and it doesn't really cause a lot of sexual dysfunctions, because the anxiety itself causes more sexual dysfunction than the medication-induced sexual dysfunction. So I tell them that there is a lot of anxiety about anxiety medications, which is again anxiety. So we kind of like take them into confidence, reassure them, telling them low dose, brief duration works well, along with encouraging them to do a lot of behavioral therapy as well. So that way it helps them.
very rarely we face patients with having nausea, vomiting, and dizziness. So how do you manage that?
Nausea, vomiting, and dizziness with SSRIs?
With very specifically paroxetine.
Paroxetine, changing the SSRI is one, and also adding, because you know all the SSRIs don't necessarily cause the same side effects as we see. So essentially it's the first line drug. So paroxetine can be switched to sertraline, and sertraline can be switched over to fluoxetine, low doses. And usually consuming with food can help, and also any antacids or any proton pump inhibitors can also be used for the initial 3 to 4 days, because it's a settling period. After that, they usually kind of settle in. So they won't have any issues mostly after 3 to 4 days. Initially, I agree, 3 to 4 days, they may have a lot of retching, a lot of nausea, difficulty, and reduced appetite. That usually settles with 3 to 4 days.
Like any specific orgasmic issue with the females, because we also talk only about men.
Yeah.
But females do face this anxiety because they focus on the periods, as mentioned very clearly. So
Yeah.
any specific medication should we give them to reduce anxiety? Will they affect ovulation also? XSRIs, imipramine.
Etazolams can be helpful. Etazolam is a
Isolams.
non-sedative, non-hypnotic benzodiazepine, because the problem with women and SSRIs is that it causes a lot of lack of lubrication and dryness effect all across the mucosal. So sex can be very painful. So I usually kind of try and avoid SSRIs in women unless it's really required. But etazolams can be very beneficial, non-sedative, non-hypnotic, so 0.5. So usually 0.5 for first maybe 3 to 4 weeks, and then 0.25 for 2 to 3 weeks. Even their overall anxiety, because like I mentioned, a lot of psychological and social factors, right? So it manages that very well. And since we lay it out to them clearly, like these are all the other issues that are, having an issue in the way that you are feeling about sexual activities, they're able to segregate that, and etazolam as a medicine can be helpful.
Fantastic. Thank you. Thanks a lot. Any participants? We have any crowds, please?
Yeah, myself, Dr. Deepak Sharma.
Hi, Deepak.
Hello.
You can.
My question to Dr. Shiva is that how long we can continue to prescribe tadalafil to the patient and a single stretch? How long we can continue?
6 weeks, easily.
6 weeks.
Easily.
And
6
thereafter
weeks.
SOS, or we can continue after a certain gap of time, we can continue again for the same?
Okay, excellent point here, because penile rejuvenation therapy is something that we can do with the PDE5 inhibitor. So 5 mg low dose on a daily basis for about 4 to 6 weeks, and then we can taper it off maybe alternate days and once in 3 days. Because SOS something that I personally don't prefer, because I believe that it induces a lot of behavioral conditioning. I take the pill and do it, take the pill and do it. And over a period of time, what happens is the patient develops confidence and condition himself only to taking the pill and doing it. So, over a period of time, like 6 to 8 weeks proper, and then after that, tapering it off alternate days, things like that can be done. And working on the thoughts can be more helpful again, to reintroduce into a more positive shift in the sexual experiences will undo all the responses and the anxiety that was associated with the failure earlier. So they usually wean off in about 3 months, maximum 2 to 3 months. We can actually make them a lot better.
Right. Are you recommend some kind of exercise like pelvic floor exercise to the ED patient? Do you recommend?
Yes, I mean, but there's a overemphasis. I want to mention here, and also interesting case, just briefly, I'll tell you. There was someone who came with something like a chronic pelvic pain syndrome, mimicking a chronic pelvic pain syndrome. He had visited urologists, andrologists, and done all the tests. Everything was coming as normal, but it was basically because of over exercising his pelvic floors. He was about to get married. He was doing pelvic floor all day long, including glute bridges, including the core exercise. Wherever he was sitting, he was obsessive. The anxiety had caused so much of obsessive compulsive problems in him. Whenever he remembers, he was doing pelvic floor. So it caused a lot of spasm. He was unable to sit in my clinic. And then we kind of like re-educated him and reworked on his thing. So pelvic floor, yes, of course, Kegels exercises is known, but mindfulness can be very, very helpful because it impacts on, shifting the nervous system to a more parasympathetic activity based approaches where it will abolish the sympathetic activity. So two things I tell them: processes or procedures wise, mindfulness, breathing exercises, deep abdominal breathing, yoga, asanas can be helpful even in the flexibility part of it, even in the pelvic activities. So glute bridges specifically for weighted glute bridges, when they can do that, can help them to enhance the core and also the pelvic floor activities. And the thought control is important. So teaching them how to manage the thoughts. Of course, they're going to get a lot of thoughts. It's a lot of natural response of the nervous system to remind us of the problem. So how we react to it is all that we need to manage. So helping them, both the aspects can help them to manage their anxiety much better.
Thank you. Thank you so much for the insight. Thank you very much.
Dr. Natesh, you're on mute, I suppose.
So any questions, or we can close the session? Yeah. Okay.
On the PDA5, I have personally found out this Avanafil, which is one of the new in the market, is quite good in for those diabetic patients. I just thought of sharing. Among the PDA5, this Avanafil is quite effective.
True. So we can give it as I usually give it as a top-up therapy, and I use Avanafil for when the patients are anxious to collect semen during the analysis.
I have found out personally it is quite effective in diabetic patients.
Yeah, that is also there. Thank you, everyone. Like Deepak sir, please take the honor to.
Yeah, it was a fantastic discussion. Dr. Shiva, you were superb. And Dr. Durai, you really explained very well why diabetes can cause sexual dysfunctions in men and women. It's not just the men, even women have low desire, all those who are diabetic. And I've seen depression in every woman diabetic. So we need to do a mental health checkup also for these women, and not just give them antidepressants, just try to counsel them and get the things set. What I have learned in this 30, 40 years of practice with diabetics, that they have very difficulty in managing lifestyle. They can't conquer their temptations to eat. They eat, that's a problem with them. So we need to be very strict with them. We need to counsel them very well and make it a point to call both of them together. Both the couple should come together, and the wife should be strictly warned that he has to follow all these things, and then things work a little better. First, try and get his metabolic milieu normal. Then give them a small dose of PD5 inhibitors in diabetes. Check their testosterone and PSA level. If PSA is normal, put them on a low dose of testosterone for some while, and they will definitely improve. As far as PD5 inhibitors are concerned, I also agree Avanafil is the best amongst all. Why? Because it has got a very short onset of action. It starts within 20 to 30 or maybe 40 minutes. It has got less PD6 and PD11 inhibition, which means they have less myalgia, less headache, less bluish greenish discolorations, which we see in patients who take sildenafil. No headache at all. And the best part is it's got a half-life of only 5 hours. So even patients who are on nitrates, there have been studies that these patients who were on nitrates were asked to skip nitrate on the day when they wanted to take Avanafil and have good enough sex. They did that, and this drug got washed out from their body in 5 hours, and next day again they can start their nitrates as they were taking it. So this is the only nitrate which you can, the only PD5 inhibitors which have been studied to be given to patients who are on nitrates. That is one good advantage. Surgical treatments are available. Very good. Now we have bionic penis, which is very good implant from Boston Scientific, but they have their own complications. In India, the success rate is there, but not very exciting, so that we can send our patients to them. 95% of diabetics improve with oral medications if they have been counseled very well. I really congratulate Natesh and Shiva and Doraiswamy for the fantastic talk. Covered every aspect of what is needed. And I only want everyone to start treating their patients. Ask their patients. That's my only urge. Please ask them that do they have any problems in making love. Every diabetic, every hypertensive, every dyslipidemic, every obese, they must ask this one small question about their sex life, which will definitely open up a conversation, and you will do a great service by giving them something very useful. If not medication, even the advice on nutritional intervention, which is very important. Thank you.
Thank
Sir,
you.
one
Thank you,
last
sir.
question, sir, if you don't mind, Jumani, sir, regarding the Avanafil and for people who are on nitrates, they can take Avanafil. How about sildenafil, sir? Because you said only Avanafil can be taken. It has advantage.
Sildenafil is unpredictable. There are no studies about it. Sildenafil definitely will bring down their pressures if they are on nitrates and taking it. But the best is Avanafil. If there are studies, we have read those studies. We have even experience giving to our patients. Even cardiologists have it. But if you want to give sildenafil to your patients who are on nitrates, please omit nitrates and put them on ranelozine, 500 milligram tablet, which is very good. It opens up the collaterals. The onset of action is also very fast. So put them on ranelozine for a few days and then give them sildenafil, which will work very well, and they will not have hypotension.
Okay, sir. Okay, sir. Thank you. And the Avanafil, the dose, sir, say the day he stops.
You start with 100 mg. Okay.
Okay.
If he says that the rigidity is not improved to that extent, give him 200 mg. Nothing wrong.
Okay. Okay, sir. Thank you, sir. And the low dose tadalafil, sir, say 5 milligram
5
can be
mg.
given.
You see, it is subjective. You start with 2.5, 5, or 10. Either of the three.
No, sir. Since the half-life of the tadalafil is say
See, what happens
40.
is tadalafil is the only PD5 inhibitor which remains 80% in the cell and 20% it's out of the cell. So if you give them low dose for a long time, over say 5 or 7 days, the amount of PD5 inhibitor in the cell is much more than what the oral dose is taking. The idea is we don't give them the side effects of PD5 inhibitors by giving them low doses. And once they, after 5 or 7 days, if the cellular level of PD5 of tadalafil is about say 10 or 12, and on the day of the act, if he takes another 10 mg, it works very well for them and don't get side effects of it. That's the purpose.
No, that's true, sir. But for people who are on nitrates, I meant the low dose should be avoided,
No,
sir. Is it
no,
better?
no. Tadalafil
we
should
can
not be
take.
given. No, not absolute no.
No. Okay. Okay.
They
Okay,
have to
sir.
omit nitrates. See,
Okay.
we say
Okay.
primum non nocere. We shouldn't do any harm. We never know. Patient can collapse. He can have low BP and collapse.
Okay. Okay. Okay, sir.
That's what
Thank
I
you.
had one
Thank
thing
you.
with
Thank you
with
so much,
the
sir.
terms of Dr. Bani says the discussion. Patients who had history of STEMI or who had history of angina, you should think twice to put them on tadalafil, because once they get an attack, they won't be able to take nitrates. So we should warn them also on this aspect.
Yep.
Okay, sir. Sure. Thank you, sir.
So we can end the session, sir.
Yes,
Thank
sir.
you.
So thank you, everyone. Thank you, Jumani, sir, Dr.
Yeah.
Doraiswamy, Dr.
Yeah.
Shivadev.
Thank you. Thank you so much, all.
Thank you all. Yeah.
Congratulations, Dr. Natesh. Excellent job done.
Yeah, the credits will go to the amazing person, Dr. like Mahendran. And thanks. Yeah.
You have done a good job.
Thank you. Thank you so much. Thank you. Mr. Mahendra, you can conclude the session. Yeah, thanks.
This is our initiative. It will continue. So thank you, sir.
Okay. So we can close it, right? Mahendra, you want to share something?
No, sir. Thank you.
Okay. Thank you, everyone.
we
Good
can-
night.
yeah,
And this
yeah,
session will
good
be
night,
available on
good night.
YouTube soon. We recorded it, and Mr. Mahendra will be sharing it soon with everyone. And we're going to come with a sequel of this sexual illness conclave with more exciting topics and different kind of speakers.